Hello and welcome to the Hormone Zoomer Boot Camp. This is session number 2 out of 5. Today's topic is toxins and hormone disruption, assessing endocrine disruptors that block function. My name is Adair Anderson. I'm the product marketing educator here in Vibrant and want to go over some housekeeping items before we get started. All attendees are in listen-only mode. If you have questions during the presentation, please submit them as a comment. We should have time at the end for Q&A. All bootcamp sessions are being recorded, and you'll get a copy of the recording and the slides after the session ends. And now, I'm pleased to introduce you to Dr. Pamela Smith. Dr. Smith is a pioneer in personalized medicine with 29 years in functional care following 2 decades as an ER physician. She holds master's degrees in public health and metabolic medicine and is co-director of the Personalized Medicine Certification Program at the University of Southern Florida's Morsani College of Medicine. A best-selling author of 14 books and a frequent media expert, Dr. Smith is senior partner at the Center for Precision Medicine and chief growth and education officer at MD Lifespan. Take it away, Dr. Smith.
Thank you so much. I hope everybody is having a great day. We could spend 8 hours looking at endocrine disruptors. So I'm basically going to concentrate mostly on bisphenol A, but I will mention some others as we go along the way. So objective-wise, we are going to look at endocrine disruptors and what happens in the body. So bisphenol A and phthalates are both chemicals used in plastics. Bisphenol A is used in the production of resins as well. And phthalates are plastics that makes them more flexible and durable. And BPA and phthalates are not the same chemical, but both are endocrine disruptors. BPA is found in water bottles and food containers. And then again, phthalates are more common in the vinyl products. So bisphenol A is literally a toxic endocrine disruptor. It can disrupt the function and activity of the body's hormones, cause dysfunction in the HPA axis and in the pituitary adrenals as well. And this study shows that there's at least 20 articles that meet the inclusion criterion that looked at significant associations between bisphenol A and other endocrine disruptors and an increase in inflammatory markers. So we're going to concentrate on BPA because, again, we really could spend all day talking about all of these. Exposure to BPA occurs through food, but again, it can also occur through water and contaminated air. So I put some of the BPAs there for you in case you're not familiar with some of them. BPAs are released into the environment through synthetic polymer and thermal printing paper, plastic containers, toys, tableware, medical devices, sealants, dental composites, and polycarbonate bottles. And the U.S. Environmental Protection Agency does report more than 400,000 kilograms of BPA are leached into the environment every year. BPA does have a half-life of 4.5 days in water and soil and less than 1 day in the air. It's also more commonly and worse released as the temperature goes up. Increased exposure to BPA, mainly by the consumption of foods, shows that we now see more in the urine in the blood. In fact, this study shows the urine of 93% of people in the United States contain BPAs. So healthy humans exposed to BPAs appears to have an accumulated body burden of BPA, and monitoring these is important because it's literally stored in lipids. BPA has been found to be present also in human serum urine, amniotic fluid, and breast milk. So it would be very important to look at women before they get pregnant. Since it goes through breast milk, it goes through the placenta, maybe we could decrease the incidence of ADD and autism by being able to therapeutically get rid of BPAs. The hepatic biotransformation depends on phase 1, phase 2 detox, going into glucuronidation, glutathione, and sulfate conjugation. And animal studies demonstrate that BPA can generate reactive oxygen species, and the majority of the academic scientists believe that participating in the FDA study, that really the FDA has set a higher goal than it should be for what is safe for bisphenol A. So it does have estrogen-like and anti-androgen properties, which can cause damage to the reproductive system, immune, and neuroendocrine systems as well. So it is a probable developmental neurotoxic at lower doses, and the brain has consistently emerged as one of the most sensitive organs disrupted by BPA. So can it cause cognitive decline? We are starting to look at this. BPA can modify DNA methylation patterns. It can increase the incidence of obesity, diabetes, and heart disease. In fact, bisphenol A is related to all of these disorders. And what I'm going to do today is I want you to have an overview of what happens with bisphenol A. I put a lot of references here so that you understand that there's many changes that occur and many disease processes that are related. However, I'm not going to go through it slide by slide. I want you to get the idea that, for example, this study revealed that urine BPA was associated with increased prolactin, estradiol, and sex hormone binding globulin in men, and it can contribute to male infertility. It contains two hydroxy groups, and it binds to both estrogen receptor alpha and estrogen receptor beta. And then this is the third estrogen receptor as well. So estrogen receptor and alpha and beta estimated to be over 1,000 to 10,000 fold lower than that of estradiol. So more recent studies have shown, let's just cut to the chase. BPA is equivalent in potency to estradiol. I'm going to say that again because it's really, really important. BPA is equivalent in potency to estradiol. So it literally equals E2. It can cause sexual behavioral problems and accelerated puberty. It could alter semen quality. It has the effect on the secretion, transport, metabolism, and binding of hormones. So hands down, it is an endocrine disruptor. However, it is so much more than that. It affects heart disease. In fact, BPA could alter cardiac function and lead to the thickening of the left ventricular wall. It has a connection with cardiovascular disease, and positive associations have been reported between blood and urinary levels of BPAs and cardiovascular events, acute MIs, stroke, and CAD in itself. These associations were more common, interestingly, in males than in females. And here, 574 adults, the high urinary BPA fertile showed higher levels of LDL and lower levels of HDL caused by BPA. Here, another great study from 2021 showing its link to heart disease. It's really every disease you can think of. How about hypertension? Several studies have suggested that urinary BPA concentrations are positively associated with hypertension. In this study from the journal Hypertension, 521 participants equal to or greater than 60, the diastolic blood pressure, systolic blood pressure, and mean heart rate is increased with increasing urinary BPA concentrations. This trial showed that exposure to BPA from drinking canned beverages increased blood pressure. So I just literally cringe when I see people drinking canned beverages. How about diabetes, the disease that is linked to the increased cost of healthcare worldwide and increased risk of other diseases if you're diabetic? When it comes to diabetes, there's a detrimental effect on the pancreas, liver, adipocytes, and skeletal muscle related to aberrant DNA methylation, histone demethylation, deacetylation, and impaired messenger RNA that was related to an increase in diabetes that occurs when the patient has high levels of BPA. And both free and total BPA concentrations were higher in urine samples from people who were diabetic. Yet another study, 3,782 adults, revealed a significantly higher risk of diabetes mellitus in the highest quartiles of BPA than the lowest. And you can see inflammatory markers rise with BPA in people who have poor blood sugar control. Several studies have reported a positive correlation between hemoglobin A1C and urinary BPA. I'm probably beating a dead horse here, but you can see in this study from 2020 as well that there's an increased risk in diabetes. How about obesity? This study found a positive correlation between the level of BPA and obesity risk. It did not matter the gender of the patient. And new evidence showed that epigenetic changes associated with man-made chemicals might interact with other factors in fetal and postnatal growth as well. In fact, some of the research is showing that if the mother has all of these toxins in her body, there's an increased risk in obesity in the child. There's an increased risk in sperm epimutations in the male, so different changes occur. And this study suggests that it's a conservative estimate that endocrine disrupting chemicals substantially contribute to obesity and diabetes, with a moderate probability of it costing more than 80 billion euros per year just related to endocrine disrupting chemicals and obesity. And the sample in children, urinary BPA was associated with obesity, predominantly in non-Hispanic white boys. And then here, adiponectin is negatively impacted by what happens with obesity and BPA. BPA inhibits the release of key adipokine and adiponectin that protects the humans from metabolic syndrome. And then from 2015, this study showed an association between BPA and waist circumference and inflammatory markers. And of course, I'm sure you knew I would come to cancer. Bisphenol A is related to breast, colon, ovarian, prostate, and thyroid cancer. And then the role of BPA in hormonally related cancers in this study was the same. And it does increase inflammatory markers. It also negatively impacts the different signaling pathways that are discussed in this article. BPA increases ductile density and sensitivity to estrogens after BPA exposure, so generally shown an increase in breast cancer. Another study showing that BPA can promote DNA instability by disturbing DNA damage signaling pathways. And here, the treatment of human breast cells with low doses of BPA induced reactive oxygen species, DNA double-stranded breaks, and upregulation of C-like protein. All of these are damaging things that can occur. This animal study showed the same changes that would occur with poor methylation. And here, large-scale epigenetic changes from fetal BPA exposure can lead to altered gene expression patterns, intraductal hyperplasia, and ductile carcinomas in situ in adults. Another study showing that it alters homeostasis. And here, BPA exposure does affect prostate cells and cancer development. And pretty much anything that affects breast cancer also negatively will impact prostate cancer. BPA does interact with other steroid receptors like androgen receptors, and it can induce prostate cancer cell migration as well. Here, BPA exposure mimics the effects of estrogen in ovarian cells, so it is linked to ovarian cancer. And this study showed that the signaling axis was literally changed with endocrine disrupting chemicals like BPA. How about endometrial carcinoma? This is an animal study. The exposure showed disrupted, unique, low-dose BPA gene signature with predictive value for survival outcomes in people with endometrial cancer. And then when it comes to thyroid, this interesting study from 2022. Results of this trial suggest that exposure to BPAs and other endocrine disruptors are associated with an increased risk of thyroid cancer, and lipid peroxidation may be an intermediate mechanism. Also, it causes oxidative stress and increases the toxicity of colon cancer cells. And this study demonstrated that BPA at the nanomolar and greater concentrations modulated the protein. Cognitive decline. BPA does impair memory and cognition. It binds to estrogen receptors. It inhibits ERK, CREB, BDNA, F signaling pathways. In other words, it alters the expression of synaptic proteins. It impairs the morphology of pyramidal neurons in the hippocampus, and you get a dysregulation of thyroid hormones, which alters the neurotransmitters. Wow. Doesn't this really explain a lot about what happens with our patients? We just don't look enough at endocrine disruptors. ADD, ADHD. The study revealed a connection between exposure to bisphenol A and ADD, ADHD. And another study revealed that prenatal BPA exposure caused hyperactivity in girls. This is almost every disease we can think of. Psychological changes. Several studies have revealed that prenatal BPA exposure is associated with higher levels of internalizing symptoms like anxiety, depression, and withdrawal, and externalizing symptoms, for example, lower emotional control and inhibition in children. So prenatal BPA exposure has been associated with higher levels of internalization and externalization symptoms of aggressive behavior in boys and emotional reactivity. And then here a positive association between prenatal BPA and symptoms of depression and anxiety. And this study was in boys. This trial suggested association, both prenatal and childhood exposure to BPA had an adverse outcome in children's behavior. Altered immune function in autoimmune diseases. BPA appears to activate many immune pathways involved in both the autoimmune disease development and autoimmune reactivity provocation, looking at the cytochrome P450 system, along with immune signaling, hyperprolactinemia. You could spend a whole day on just this. But in summary, BPA, an endocrine disruptor, literally alters immune function. So despite proper hepatic biotransformation of BPA, the accumulation in the body reservoirs sets the stage for immune reactivity and the onset of autoimmunity. When I was in medical school, there were 24 autoimmune diseases. There's now 108, with the 107th being long haul or chronic Lyme, and the number 109 is related to long haul COVID. Patients with abnormal hepatic biochemistries have been shown to have higher frequencies of autoimmune diseases, and there's a growing body of evidence showing that increase in toxic loads depletes hepatic tolerance. This leads to an overactivation of both immune systems, the innate and the adaptive immune systems. And then you can see how you would have a development of more autoimmune diseases. In this trial from 2014, higher BPA concentrations were associated with increased abnormal liver function tests. And here, the cytochrome P450 system and its enzymes play a crucial role in the liver. They're involved with oxidation of organic substances and the bioactivation of many drugs that we use, along with phytoestrogen. However, environmental xenoestrogens, like BPA, have the potential to be metabolized into reactive oxygen species, which are then involved in apoptosis and an increase in autoimmune diseases. You can see there's just a zillion articles. ROS has the ability to induce autoreactive molecules that can be involved with both the onset and the exacerbation of autoimmunity, and again through the CYP enzymes. So when you look at xenoestrogen exposure and autoimmune diseases, there's an increase in circulating estrogens have demonstrated a relationship with greater autoimmune activity. And this includes xenoestrogens such as BPAs. And we do know that there's some autoimmune diseases that are more common in women related to estrogens, such as Hashimoto's thyroiditis, lupus, and rheumatoid arthritis. Epidemiological evidence suggests a significant increase in the prevalence of autoimmune diseases may be attributable to environmental estrogens in this trial, and that BPA and LPS induced nitric oxide production. So bacterial translocation of LPS can activate oxidative and nitrosamine stress pathways associated with the inflammatory responses and pathophysiology of autoimmune responses. So a little bit of inflammation heals, too much causes disease. And BPA directly impacts the LPS activation of these pathways. And the role of BPA on LPS activation is part of the abnormal immune reactivity that causes the autoimmune response. This study showed the same thing. How about BPA's effect on immunoglobulin activity? Research has shown that BPA has a direct impact on increasing immunoglobulin expression into the inflammatory IgE response, potentially causing an increasing inflammatory cascade of autoimmunity. And you end up with BPA and autoimmune molecular mimicry. So BPA and T3, so it even affects thyroid, possesses a degree of molecular structure similarity that BPA may act as an antagonist compounded on the T3 receptor sites. That's really key because remember the T3 is the one that fuels the mitochondria. This is the one that gives the patient energy. This is the one that helps prevent heart disease. But if BPAs and T3 possess a degree of molecular structure similarity, then BPA can be an antagonist compound on the T3 receptor sites and literally kick off T3. So potential mechanism for the role of BPA in autoimmunity may be structural molecular mimicry, in particular in people with thyroid hormones. So it's not just the hormones you were thinking about, the sex hormones, estrogen, progesterone, testosterone. It literally even affects the conductor of the hormonal symphony, the thyroid. About 70% of the risk for developing autoimmune thyroid disease is attributable to a genetic background, environmental triggers that are thought to play a role in the etiology of autoimmune thyroid disease and people who are susceptible. There's an increase in allergies and asthma as well. I've been practicing for 47 years. We're starting to see an increase in all of these diseases. And numerous additional studies suggest a relationship between environmental estrogen exposure and the development of allergic disease. And in this study from 2015, emerging science indicates that deleterious immunological changes, including increased propensity to develop wheezing, allergy, and asthma after dietary and inhalation exposure to these chemicals may be occurring. So DEP can induce the production of pro-allergy Th2 cytokines, including interleukin-4 and TNF-alpha in the macrophages. And DEHP can cause literally mast cells to degranulate. They can release histamine and beta hexoamidase, which causes this allergic response. And this study observed a statistically significant relationship between BPA concentrations and allergic rhinitis in children. This one is from 2021. In fact, increased levels of BPA were associated with disease severity. Another study found that BPA exposures were associated with IgE levels and increased the risk of developing allergic diseases in children, particularly in girls. Estrogens can have potential effects on every step, each step of allergic sensitization that occurs in the body. It's not just mast cell degranulation, but it affects antigen presentation, type 2 T helper cells, colorization, and isotype switching to immunoglobulin E. And again, probably beating a dead horse, but this animal study showed the same thing when it occurred with asthma. And then kidney and liver disease. An analysis of adult participants in the US, an association between urinary BPA concentrations and reduced GFR. This study showed that high blood concentrations of BPA can be a factor in developing kidney disease, particularly in people who are diabetic and people who have hypertension. And liver, urinary BPA levels are positively associated with the risk of non-alcoholic fatty liver disease in adults. And you probably have the same patients I have in my practice, people that have slightly elevated liver enzymes. Where does it come from? What do we do with these patients? Some of this is related to urinary BPA levels. And of course, as much as I'd love to talk about hormones, and those of you who know me know I love to talk about hormones, the patient is not healthy until their gut is also healthy. It is really about tying all of these together. So the disruption of a normal gut flora by BPA can impact metabolic pathways, intestinal permeability, and barrier function. So can BPA cause leaky gut syndrome? Absolutely, positively. This animal study revealed the alpha and beta diversity analysis showed that dietary BPA intake led to a similar gut microbial community structure induced by a high-fat diet and a high sucrose diet in mice. Wow, the gut bacteria are not stable. Dermatological disorders. People ask me about dermatology. My first response is always look at the gut. BPA may be a factor in acne development and its severity. And of course, infectious disease. When we look at infectious disease, one of the ways that we get rid of BPAs is therapeutic plasma exchange. And in this study, TPE of COVID-19 patients may help by removing toxic cytokines, viral particles, and by correcting coagulopathy and restoring endothelial membranes. So therapeutic plasma exchange is actually what I personally use in my practice to get rid of BPAs. In fact, I really didn't measure BPAs as much as I used to. Even though I have a master's in toxicology, I quit measuring BPAs all the time because I didn't have a good way of getting rid of it until recently. Basically, I could do a sauna, it would get rid of some of it, but it was really hard to get rid of endocrine disruptors. Yes, we did a great model with toxic metals. We could get rid of lead, mercury, cadmium. Not so easy to get rid of gadolinium, pesticides, mycotoxins, even if you give binders. So I went looking really with one of my partners down a little different road. Having been an ER physician, I was used to therapeutic plasma exchange. We did it in the ER many, many years ago. In fact, TPE's been around for 50 years. There was life before Narcan. And so before Narcan, how do we get a drug overdose out of the patient? How do we get the heroin, et cetera, out? We actually put them up to a TPE machine. We did find, however, the TPE alone does not give you the same spectacular results that you're about to see that we published in a medical journal last week. Microplastics were decreased by up to 90%. Heavy metals decreased up to 80%, with aluminum decreasing up to 100%. BPA and phthalates up to 97%, and environmental toxins up to 95%. There's other articles supporting this idea as well. So I have for a long time used Vibrant House toxin test to really look at what we're doing with our patients and toxin removal. I love Vibrant's Hormone Zoomer test. I love the way that Vibrant has actually put together a number of things together because it's really how your mind thinks when it comes to this test. So the Hormone Zoomer includes 13 endocrine disruptors. If you want to look at all of the toxins, you order the Vibrant Toxin Test. If you want to look at hormone disruptors like BPAs, phthalates, and the rest, then this is the test you would order. I love the way that they have set it out. The green, I lovingly say, is normal. Yellow, borderline, red, bad. And you can see how all the things are listed here that you can look at with the patient. When it comes to endocrine disrupting mechanisms, if you could turn off my picture, that would be great because then I can enlarge the slide here. Perfect. Thank you so much. If you look at endocrine disruption mechanisms, then you can see all the way down the line here that you have mimickers. Then you can look at how it modifies the estrogen receptor sites along to affecting hormone distribution and levels in the body. Then you go all the way down to hormone transport, which is really key to look at. It affects how the other changes that occur as well, the epigenetic modification that can occur, hormone changes related to the cells as well. So you actually get a great explanation of the endocrine disrupting mechanisms that occur in the body that are right on this test. And I do sit down and go over this with my patients one by one. So there's 5 endocrine disrupting mechanisms. So you can see at the top there's your bisphenol A. You got the green, the yellow, the red, and you can see this patient is very, very high. They're at 8.2, which is really a very toxic level of BPA. And there's 5 endocrine disrupting mechanisms. There's modification of the receptor expression. It blocks hormone signaling. You have epigenetic modification of hormone-producing cells. Hormone transport is affected, and it affects hormone distribution and levels in the circulation. And you don't have to guess about this. You don't have to be a toxicologist. Vibrant has actually put this right on the test for you. The explanation is right there as well. So it makes it very easy to explain to the patient, including even the hormone signaling. The patients are really well read. They don't have to be in medicine. They get on and read Dr. Google and they realize that thyroid's infected. And so this actually goes through blocking hormone signaling, even related to thyroid hormone. And here you see the epigenetic modification of the hormone producing cells. There's your great explanation and the development of how it occurs. And then the next is hormone transport. And then the next is how it affects hormone distribution in the circulation. And they go through the entire pathway. Again, this is right on the test for you. So here is what it looks like if you're looking at blocking hormone signaling. The hormones there, you have the hormone receptor site, and then the endocrine disruptor really negatively impacts the signaling itself. This is BPA 8.2. Normal is less than or equal to 5.09. So hormones communicate with the cells. They bind to specific receptor sites. A key player in this process is a steroid receptor coactivator, SRC1. This helps hormones attach to the receptor sites because you have to be able to attach the hormone. It does not work very effectively if it just sits there without attaching to the receptor itself. BPA promotes the receptor beta for boosting the binding of hormones to the receptors. And research has shown that BPA increases the amount of SRC1 in the animal cell lines, and that does include increasing the risk of breast cancer cells. And BPA has been identified as an antagonist of thyroid hormone action. It inhibits T3 binding to the receptor, and it disrupts the signaling pathway. BPA affects the androgen receptor's ability to bind testosterone as well, and dihydrotestosterone. This alters the biological effects. So the reference and the interference can lead to reduced efficacy of hormone actions mediated by these receptors. Not only is this an increased risk in all these diseases we've talked about today, but if you don't go back and fix endocrine disruptors, you will find in your practice, in your pharmacy, exactly what I'm finding. There are some people you can't give hormones to. I don't care who you are. They can't even take a baby amount of progesterone. They actually get anxiety from it. And that's because we need to back up a step and get rid of the toxic load in the body. It's a cumulative toxic load. And certainly with endocrine disruptors being everywhere. And I really do ask my patients, do you have a water filtration system at your house? Do you have an air filtration? Do you drink out of plastic bottles? What kind of cosmetics do you use? Because all of these can go down a negative road. So here you can see it blocks hormone signaling still. Here it is an endocrine disruptor as well in males. So it's not just women that are affected. And men, it can cause impotence. It binds to estrogen and androgen receptors, which disrupts their signaling. How is that affected in a male? Is it? It is because men make estrogen. They need estrogen for memory. They need estrogen for bone structure, or they can get osteoporosis. Too much estrogen increases the risk of heart disease. It increases the risk of prostate cancer. So whether it's males or females, it doesn't matter. You still need to look at endocrine disruptors. It's not just decreased sperm count. As you've seen, the signaling affects glucose levels and how that affects in the body, along with thyroid. So in conclusion, and then we'll take questions, bisphenol A and related compounds are associated with the development, I think you've seen today, of numerous disease processes. It's not just endocrine disruption, although certainly endocrine disruption itself is more than enough Yes, there's an increase in prostate cancer. Yes, there's an increase in breast cancer and ovarian and endometrial, but also other diseases we talked about, from hypertension to heart disease to kidney disease to liver disease. Fortunately, we now have great testing. The Vibrant Hormone Zoomer test helps us determine if the patient has elevated levels of endocrine disrupting chemicals like BPAs and parabens. It's an easy test to do. It's not terribly overly expensive for the patient. The great news is we now have exciting ways like TPE to also remove it. So everybody in the world, from my personal opinion, should have a Vibrant Hormone Zoomer test. All patients should, because we can even see from these studies in children, you could have a negative impact as to what happens as to whether they're going to develop obesity or not as a child and later on in life. Here's my contact information if you're interested in any questions you may have today, although I'm going to open it up for questions. If you're interested in the personalized medicine certification or the personalized TPE certification that I direct the Moore-Sinai College of Medicine at USF, there's the website. So I'd love to open it up to questions.
Right. Thank you, Dr. Smith, for that phenomenal presentation. We are so lucky to have you with your background in toxicology and your time in the ER doing TPE for drug overdose. Amazing, amazing. We do have some questions. I'm going to scroll back to the beginning. We'll start at the top and then work our way down in the order they came in. So the first one came in at 1:43 Eastern time, which was okay. From Lexi, how do you feel about cans that claim to be BPA-free? Can we trust those?
It depends really on the science. Cans that claim to be BPA-free, I still do research on them. So whatever store is selling them, I still look at it. It's hard for them to be totally BPA-free, but there are some.
Okay. Thank you for that. Next question was, can BPA impact eosinophil protein X levels in the gut?
It can. And that's why I was alluding to when I was talking about histamine function. It absolutely can increase that. In fact, when it comes to chemically sensitive patients, people who have a reaction to everything in the world, they can't, use anybody's soap. They have to have special cosmetics. They have to have special laundry detergents and everything else special in the world. If you go back and look at the gut, you'll see that the inflammatory markers are high and the EPX is also elevated as well.
Right. Thank you for that clinical pearl. Looking at them all right now in my pocket. All right. Nikki wants to know, is this presentation something we can share with patients? Do you mind if we share the slide deck?
Right now, what you can do is share the article that we just published, and I'm happy to send that out. I'll send it to you. Okay. And then you can share that with everybody because I keep updating my talk. And that's why I usually don't give it out to everybody because we update it all the time. But I'm happy to share that article that just came out. We'll send it out over.
Okay, perfect. We'll put that in the follow-up email.
Perfect.
All right. Next question. What are the risks of therapeutic plasma exchange, if any?
Oh, that's a great question. If you're talking about therapeutic plasma exchange, you take out the plasma and clean it and put it back in, you can have a 25% reaction rate. But that's not what we're doing with this. We're taking out the plasma and putting back in albumin. And so our reaction rate is very, very low. And what have they been? Number one, if people do not eat before they have TPE, because it takes 3 hours and then an hour of IV, if they don't eat ahead of time, they can go woozy. We actually had a patient who passed out because they lied to us. We actually make people sign on a dotted line. Hi, we haven't eaten. All three lied to us. So they had coffee. That's what they call breakfast. Breakfast really is the most important meal of the day. I was serious about that statement. So provided they eat breakfast, no issues there. It does take everything out. So it takes out the nutrients. It does take out their medications that day. And so it's part of the reason we give the nutrients back. And very, very early on, we had a few people who had low calcium. We discovered it right away because we're running tests immediately. So now Tums is just calcium. We give everybody 10 Tums. before they have the TPE, so that we know they don't get low calcium when they're having the study done. It just really stopped any complications. So we also do a half an exchange for people who are really small, because it is an exchange. Somebody my size with TPE for me, I'm just doing half an exchange at a time. And I was terrible for mycotoxins. I thought my BPAs would be higher than they were, but I did the Vibrant toxin test on myself, and oh my gosh, I did another company's toxin test when we looked at fungi, et cetera. I was totally clear. And then when I did your test, I knew I didn't feel perfect. And I kept having allergies and this whole thing up here and, kind of sinusitis, et cetera. And oh my God, when I did the toxin test that Vibrant Health has, I had every mycotoxin there was, all in the red level. So the TPA has really been helping with the mycotoxins too.
Awesome. Thank you for that. Next question comes from Cora. She wants to know, could you please talk about how to get TPE for patients and how to set this up in office?
It's hard to set up in a single doctor's office because it's really, really pricey. Okay. The machine's really pricey. The whole process is pricey. The nurse has to stay in the room the entire time. They can't leave. But if you email me, you've got my email on the last slide. Please email me. I'm happy to let you know centers that literally have done these protocols so that we know that they worked. And again, they're all being published.
Great. Thank you for that. And then follow up to that, Leslie wants to know, is there a good protocol to follow to get rid of BPA if you aren't able to do that therapeutic plasma exchange?
There is. I'm working on that research now. I'm actually writing a book on all of this. It'll be book number 15, but I'm writing a book on toxins in today's environment. And so I will be putting nutrients that help as well. But if you've got somebody like me who's got all these mycotoxins, taking nutrients isn't going to work. If you just have one or two, will binding them work? It will. Are there nutrients that get rid of BPAs? There are, but again, it can't be in the red. Okay, if it's in the yellow area, can we do some? Yes, and hopefully that book will come out next year.
Gotcha. Looking forward to that. Thanks. Specifically about cosmetics, what do you recommend to avoid some of these endocrine disrupting chemicals?
I only use 2 on my skin, and granted, I have sensitive skin for obviously mycotoxins, etc. So I either have mine compounded, face creams, eye creams, neck creams, etc., for longevity, because aesthetically you want your skin to look good. And then otherwise, I use Gwyneth Paltrow's products because you can't be totally toxin free, but they're really, really close to totally toxin free. So I recommend her products. She does a great job.
Thank you for that. I think we already addressed Anne's question about, apart from avoiding BPAs, is detoxification the only way to get rid of it from the body?
It certainly does great. So the first thing to reiterate, avoidance. Avoidance is number one. Okay, we can all do that, and so can all of our patients. Number two, there are some nutrients, but I want to validate some of the studies before I discuss them because I'm just doing that research now. And then, of course, TPE would get rid of people that are really, really high in the red area. If you want just one nutrient, you probably all guess that glutathione is one of those. I can probably say that there's enough research without me saying I need to do more. Glutathione would be a place to start.
There we go. That definitely supports detoxification in the liver. All right. One specific question from Olga. Can a child or adolescent with precocious puberty benefit from the test? If yes, how?
I'm sorry, I didn't hear that.
Can a child or adolescent with precocious puberty benefit from Vibrant's Hormone Zoomer?
That's a great question. We don't know. Right now, we're only doing TPE in adults. We're doing it obviously in women before they get pregnant to be healthy, to have a healthy child. Whether it can help otherwise in between, honestly, the studies just aren't there. So I'm going to say we don't know.
Okay, thanks for that. Susan wants to know, how can TPE providers be found?
Just email me. Happy to let you know.
And again, we're going to add your contact information to the slide so people can get that. We might have already covered this. What contraindications are there for TPA, including allergies to things such as egg?
Actually, eggs is not a counterindication. Great question. Well, I have an egg sensitivity. What does that mean? It means if I have eggs at home that are organic or my own chickens, then I can eat eggs. I cannot eat eggs out in any restaurants because the antibiotics drive me totally insane. So it has to be my own omelet that I'm making, etc. Counterindications to TPE are a very low GFR, would be probably the number one. Someone who's been really sick recently, like they had an acute MI, we would wait 6 months. One of my best friends is a pharmacist, and he had had an acute MI at a young age in his late 40s. And we just got his results back. So we did his repeat Vibrant test, toxin test. It's awesome. He actually has even his creatinine's improved because it was 1.2, now it's 0.9. And almost every toxin except for two that were in the red have all done better with the TPE. And he actually did a new calcium score, and his calcium plaquing was down 17%.
Amazing result. Wow. Next question comes from Luis. What do you think of homeopathic remedies for removal?
I believe in homeopathy. I truly do. I've been very blessed that I've gotten to learn from people who do homeopathic medicine and Ayurvedic medicine and conventionally and from a functional medicine approach and personalized medicine. I've been lucky in my 47 years to be able to help people in many ways. I do believe in homeopathy. It just isn't strong enough if someone is way out to the red area. Certainly the people in the sort of borderline area, would it be beneficial? Absolutely.
Okay, great. Thanks for that affirmation. And then coming back to glutathione, is there a glutathione supplement you have found to be the most effective?
Well, I hate to mention companies when I'm kind of doing things of this nature. So anybody who's pharmaceutical grade, that's really the best thing to look at. When we do TPE, we have been giving IV glutathione, which, as you all know, in the old days, that's the only way you could give it. Now there is a liposomal form, which is what you should be using to be the most effective for the patient.
Okay. And then another question here. What are your favorite binders for BPA?
They do not work. We have discovered that. We did a controlled trial. If you're talking about mycotoxins, then obviously charcoal and related things work. Cholestyramine as a drug works, but when it comes to BPAs, you cannot chelate them out totally. You cannot bind them out. When we do the TPA, then we are giving DMSA to get rid of a lot of the toxic metals. We are giving LDN in order to help the patient with the inflammatory response and the inflammation that occurs. But to answer your question, binders will not get rid of BPAs. I've tried for 47 years.
Okay, thanks for confirming that. And then one final question. While we wait for your book, what resources do you recommend for doing our own deep dive in additional research into detoxification approaches, specifically for endocrine disrupting chemicals?
I'd love to say come join the certifications, particularly the TPE one. We have toxicologists speaking and immunologists, and we really go through a lot of people's opinion on it. As you all know, I'm the most conservative speaker professor probably in the world. So I only give you, this is what I've deep dived into. But you can come and learn from, other people that may say, there's one article that shows this. But more to come on all this.
Okay. And then one other question came in while you were explaining that. Have you tried the newer topical glutathione called Luteril?
I have, and I have found so far that it works in some people. Some people, it may just be the base that it's in. It doesn't work. So a lot of it depends when you put something on the skin, including hormones. It depends on the base that you put it in.
Okay. And that was our last question. You got through all of them. Thank you so much for sticking around for all of those. Thank you for the presentation. And thank you everyone in the audience for joining and asking questions today. Thank you, everyone. Have a great day. Take care.
Bye-bye, everyone. Thank you so much.
This webinar is for educational and informational purposes only. It is not a substitute for professional medical advice, diagnosis, or treatment. The views expressed by guests and hosts are their own and do not necessarily reflect the official policy of Vibrant Wellness. As always, consult your healthcare provider before applying any recommendations that you have heard here today.